Have you ever wondered why the liver is so crucial in the human body? Well, it's about time we shine the spotlight on this vital organ. The liver, our body's largest internal organ, is a fascinating and complex structure that plays an essential role in our overall health. It's tucked away in the right upper quadrant of our abdomen, just beneath the diaphragm, and is divided into two main lobes, the right and the left. But it's not just its size that makes the liver so remarkable. Its unique structure, composed of millions of cells called hepatocytes, is designed to perform a multitude of functions. These hepatocytes are organized into functional units known as liver lobules, which interact with a network of blood vessels and bile ducts to carry out the liver's crucial tasks. Now, you may be wondering, why is this organ so important? Well, the liver is like a multi-talented artist juggling several roles at once. It's a master chemist, responsible for metabolizing the nutrients in our food into substances our body can use. It's a vigilant gatekeeper, detoxifying harmful substances and flushing them out of our system. And it's a vital manufacturer, synthesizing proteins that are fundamental for our body's growth and repair. But that's not all. The liver also plays a role in regulating our body's supply of glucose and lipids, and it helps in the production of bile, a substance necessary for digestion. So as you can see, the liver is not just an organ sitting idly in our body. It's a hard-working, multifunctional powerhouse that keeps us healthy and functioning properly. And just like any other part of our body, it's susceptible to a range of disorders that can disrupt its normal functioning, which we'll explore later in this video. Now that we know what the liver is and where it's located, let's delve into its functions. The liver isn't just an organ, it's a versatile powerhouse. Let's begin with metabolism. The liver is like the body's personal chemist, playing a key role in metabolizing carbohydrates, fats, and proteins. It's involved in the breakdown of carbohydrates into glucose, which is then stored and released into the bloodstream as needed. As for fats, the liver converts excess carbohydrates and proteins into fatty acids and lipids. When it comes to proteins, the liver synthesizes non-essential amino acids and converts ammonia, a harmful byproduct of protein metabolism, into urea, which is then excreted through urine. Now let's talk about detoxification. Picture the liver as a vigilant security guard. It filters out toxins from the bloodstream, including alcohol and drugs. It does this by converting these harmful substances into less harmful ones through oxidation, reduction, or conjugation. These are then excreted from the body via urine or feces. Lastly, the liver is a master of synthesis. It produces essential substances that the body can't do without. These include bile, which aids in fat digestion, clotting factors, which prevent excessive bleeding, and albumin, a protein that helps maintain the balance of fluid in the body. Imagine the liver as a bustling factory, working round the clock, producing, converting, and detoxifying. It's also a generous organ, storing vitamins such as A, D, E, and K, and minerals like iron and copper, releasing them when the body needs them. So you see, the liver is not just another organ, it's a metabolic dynamo, a detoxifying machine, and a synthesis superstar. It's a silent hero, quietly performing its duties, ensuring our bodies run smoothly. But like any hero, the liver is not invincible. It's susceptible to damage, and when it's compromised, it can lead to serious health problems. With such vital functions, it's clear why any disorder in the liver can have severe consequences. We'll delve deeper into these disorders in the next scene. Stay tuned. The liver's blood supply is a complex system vital for its functioning. Now, let's delve into this intricate network known as the hepatic vascular system. Imagine a bustling city where the liver is the city center and the roads and highways are the vascular system. Two major vessels feed this city, the hepatic artery, providing oxygen-rich blood, and the portal vein, delivering nutrient-filled blood from the digestive tract. Their confluence forms a network of capillaries called sinusoids, where oxygen, nutrients, and toxins are exchanged between blood and liver cells. These sinusoids are lined with special cells called Kupffer cells, acting as diligent sentinels, identifying and neutralizing harmful substances. Finally, the cleansed blood is channeled into the central vein, which merges into the hepatic vein to exit the liver. This intricate system ensures efficient delivery and processing of substances and swift removal of waste. A disruption in this balance can lead to liver diseases. A well-functioning vascular system is crucial for a healthy liver. Unfortunately, the liver, like any other organ, is susceptible to disorders. This complex multifunctional organ may fall prey to a variety of illnesses, affecting its ability to perform its vital roles. Let's delve into some of these ailments, shall we? Firstly, we have cirrhosis, a late-stage liver disease characterized by scarring of the liver tissue, leading to its inability to function properly. This is often the result of long-term damage, with chronic alcoholism and hepatitis being the most common culprits. Then, there's hepatitis, an inflammation of the liver usually caused by viral infections. But hold on to your hats because there are 5 types of viral hepatitis: A, B, C, D, and E. Each type is caused by a different virus, and they all have different modes of transmission, from contaminated food and water to blood and other bodily fluids. Next up is fatty liver disease, which, as the name suggests, is the accumulation of fat in the liver cells. This can be of 2 types: alcoholic fatty liver disease, caused by heavy drinking, and non-alcoholic fatty liver disease, which is often associated with obesity and high cholesterol levels. Liver cancer is another major concern. The most common type is hepatocellular carcinoma, which begins in the main type of liver cell, the hepatocyte. It often occurs in people with chronic liver diseases like cirrhosis. And let's not forget about gallstones, which are not a liver disorder per se, but can cause liver problems if a stone blocks a bile duct. This can lead to a condition called cholecystitis, an inflammation of the gallbladder that can cause severe abdominal pain. So, as you can see, the liver can be affected by a wide variety of disorders, each with its own set of causes, symptoms, and potential complications. Understanding these disorders is key to diagnosing and treating them effectively, ensuring the liver can continue to perform its vital functions. Now, let's dive deeper into the pathophysiology of these common liver disorders. To understand liver disorders, we need to understand their pathophysiology. Now, the pathophysiology of liver disorders is a complex process involving a series of cellular changes and reactions. At the heart of many liver disorders, you'll find inflammation, fibrosis, and hepatocyte damage. Inflammation is the body's initial response to injury, including injury to the liver. It's a protective response designed to remove harmful stimuli, including damaged cells, irritants, or pathogens. However, when it comes to the liver, chronic inflammation can lead to more harm than good. Over time, it can result in the death of liver cells or hepatocytes and the formation of scar tissue, a process known as fibrosis. Fibrosis is essentially the liver's attempt to repair and replace damaged cells. But when this process goes overboard, it leads to the accumulation of excessive scar tissue, which can distort the liver's structure and impair its function. This is the hallmark of cirrhosis, one of the most severe forms of liver disease. The damage to hepatocytes is a key player in the progression of liver disorders. Hepatocytes are the workhorses of the liver, performing the majority of its functions. When these cells are damaged, whether through infection, toxins, or metabolic disturbances, they can't do their job properly. This leads to a cascade of problems, including impaired metabolism, reduced detoxification, and decreased synthesis of vital proteins. As liver disease progresses, these cellular changes can lead to serious complications, including portal hypertension, liver failure, and hepatic encephalopathy. The liver's remarkable ability to regenerate can also be compromised, leading to a vicious cycle of damage and repair. To sum up, the pathophysiology of liver disorders involves a complex interplay of inflammation, fibrosis, and hepatocyte damage. By understanding these processes, we can better understand the progression of liver diseases and identify potential targets for treatment. But how do we diagnose these disorders? Diagnosing liver disorders involves several methods. It's essential to get this right because early diagnosis can make a world of difference in managing these conditions. Now let's look at some of the common diagnostic methods. Blood tests are often the first step in diagnosing liver disorders. These tests measure the levels of certain enzymes and proteins in your blood. Elevated liver enzymes, for example, can be a sign of liver inflammation or damage. Liver function tests are a subset of these blood tests. They measure how well your liver is performing its essential tasks, such as producing proteins and clearing bilirubin, a waste product of red blood cells. Abnormal liver function test results can indicate a problem with the liver. Imaging studies provide a visual insight into the liver. Ultrasound, Connecticut scans, and MRI are some of the techniques used. These imaging studies can reveal physical changes in the liver such as enlargement, nodules, or signs of cirrhosis. A liver biopsy, though not as commonly performed, can provide a definitive diagnosis. In this procedure, a small piece of liver tissue is removed and examined under a microscope. It can reveal the extent of liver damage or the presence of cancer cells. Now, let's talk about viral hepatitis serology. This is a series of blood tests that detect and measure antibodies produced in response to a hepatitis virus. The presence of certain antibodies can confirm a hepatitis infection and can even identify the specific type of hepatitis virus. But why is all this important, you may ask? Well, these diagnostic tools not only help in identifying a liver disorder, but also guide the treatment plan. They provide vital information about the severity of the disorder, the extent of liver damage, and the underlying cause. All these methods combined provide a comprehensive view of what's going on in your liver and help doctors make the most informed decision about your treatment. Once diagnosed, what are the treatment options? Well, that's a great question. The treatment depends on the type and stage of the liver disorder, but we'll delve into that in our next scene. Treatment for liver disorders varies based on the specific condition. It's a world where one size doesn't fit all, and a tailored approach is key. Let's dive in to explore the various treatment options available. First up, lifestyle modifications. These are often the first line of defense and can have a significant impact on liver health. For fatty liver diseases, losing weight and maintaining a healthy diet are paramount. Reducing alcohol consumption is crucial for alcoholic liver disease, while avoiding risk factors like unsanitary needles or unprotected sex can prevent viral hepatitis. Next, we have medications. These are usually disease-specific, aimed at targeting the root cause or managing symptoms. For example, antiviral drugs are employed to treat hepatitis, while corticosteroids and other immune suppressants can help manage autoimmune liver diseases. In the case of cirrhosis, medications might be used to control the complications, such as ascites or variceal bleeding. But what if lifestyle changes and medications aren't enough? This brings us to surgical interventions. Procedures like banding or sclerotherapy can control bleeding varices, a complication of cirrhosis. Tumor ablation or resection might be used in the case of liver cancer. And then there are advanced procedures like transjugular intrahepatic portosystemic shunt or TIPS, which can help manage complications of portal hypertension. In this procedure, a shunt is placed between the portal vein and the hepatic vein to reduce pressure in the portal system. Now, it's important to remember that these treatments aim to manage the disease, alleviate symptoms, and improve quality of life. However, they may not always be able to reverse the damage done to the liver, especially in advanced stages. In severe cases, a liver transplant may be necessary. It's an intricate procedure where the diseased liver is replaced with a healthy one from a donor, but we'll delve more into this in the next scene. After all, the journey to understanding liver disorders is as complex as the organ itself. Liver transplantation, a life-saving surgery, is a last resort treatment option. This procedure is considered when all other treatments have been exhausted, and the liver, a magnificent organ that performs over 500 functions, is no longer capable of fulfilling its role. This could be due to a variety of reasons, including end-stage liver disease, a condition where the liver has sustained significant damage and can't recover or regenerate. The process of liver transplantation involves replacing the diseased liver with a healthy one, often donated by a living or deceased donor. It's a complex surgery, but the goal is simple: to give the recipient a new lease on life. Post-surgery, recipients typically require lifelong medication to prevent their body from rejecting the new organ, but many go on to live full, healthy lives. Liver transplantation is a beacon of hope in the darkness of end-stage liver disease. For those who wish to delve deeper, there are numerous resources available. For those seeking more in-depth knowledge on liver disorders, plenty of resources are available. From textbooks to guidelines, even research papers, the world of knowledge is vast and open to exploration. Textbooks such as Schiff's Diseases of the Liver or Hepatology, a textbook of liver disease, offer detailed insights into the liver's anatomy and disorders. For guidelines, the American Association for the Study of Liver Diseases provides comprehensive and regularly updated information. Research papers can be found on databases like PubMed or Google Scholar. They allow you to dive deep into specific topics, from the molecular pathways of liver disease to the latest advancements in treatment. Always ensure your sources are credible and up-to-date, as medical knowledge is constantly evolving. Websites such as Medscape, Mayo Clinic, and WebMD are reliable places to start. Remember, understanding the liver is a step towards better health. Stay informed, stay healthy.